Hello and welcome to Speaking of Soy, a discussion about soy and human health, sponsored by the Soy Connection Health and Nutrition newsletter and the United Soybean Board. Today's program focuses on the role of soy in the treatment and prevention of cancer. Our guest today is Dr. Mark Messina. Dr. Messina wrote an article on this topic, which appeared in the Volume 25, number 2 issue of the Soy Connection newsletter. Dr. Messina, thanks for being with us today.
Oh, my pleasure.
Doctor, the new issue focused on the role that soy may have in reducing risk of a number of cancers that haven't been discussed as much as breast and prostate cancer. Before moving on to these and other cancers, what is the latest research regarding breast and prostate cancer?
Well, I'm happy to say the research is looking very encouraging, especially for breast cancer. There's really quite a bit of support for this hypothesis. There's animal data. There are population studies showing that soy intake reduces risk of breast cancer. And we also have a pretty good understanding of just why soy, or just how soy reduces risk of breast cancer. But the key is that in order to derive this particular benefit, soy consumption has to occur very early in life. That is during childhood and or the teenage years. So I strongly recommend that all girls consume at least 1 serving of soy per day. A serving of soy can be a cup of soy milk or a half a cup of tofu. It's very easy to incorporate that much soy into the diet, and there are really some significant potential benefits. And at the very least, soy is a very nutritious food. In regard to prostate cancer, the population studies suggest that men in Asia who consume about 2 servings of soy per day are about 50% less likely to develop cancer in comparison to Asian men who consume relatively little soy. So both for prostate cancer and breast cancer, the data look quite encouraging, but I'm more excited about the breast cancer data.
Doctor, in this piece, you note from the outset that establishing a relationship between diet and cancer is extremely difficult, and that understanding these relationships is based primarily on cohort data. Can you elaborate on why establishing diet-cancer relationships is so difficult and describe the importance of cohort data?
Yes, and you're absolutely correct. It is difficult to definitively establish diet and cancer relationships. And the reason is because we really lack what are called intermediary markers of cancer risk. There are a couple of them, but not very many. So let me give you an example. If you're going to study heart disease, you can do a very short-term study, measure blood pressure, which is a non-invasive measurement, prick somebody's finger and measure cholesterol. If blood pressure goes down, if cholesterol goes down, we have a really good idea that that intervention will have reduced risk of heart disease. We can't do those kind of studies with cancer, so we have to rely on cohort studies, or often called prospective studies. These are studies that enroll as many as 50,000 individuals. They're healthy at the time of their enrollment, and then they're followed for a period of 20 or 30 years, and then we look to see how their diet correlates with the risk of developing a particular cancer. So those studies are less definitive. They take a longer time, and they are also very, very expensive. But nevertheless, we still have some good insights about diet and cancer from these types of studies.
Well, now I'd like to discuss a few of the cancer types presented in the article and results of the research on the role of soy in each type. So let's start with endometrial cancer. What effect did a soy diet have on the increase or decrease of endometrial cancer risk?
Well, endometrial cancer is a really interesting one, because what we know for certain is that the hormone estrogen increases risk of endometrial cancer. And because soy contains plant estrogens, there have been a number of questions about the impact of soy consumption on risk of endometrial cancer, which is a very common cancer in women. potentially soy could both increase or decrease risk. An argument can be made for both of those sides of the equation. But what the studies show is that, much to my delight, is that soy consumption is actually associated with about a 20% decrease in risk of this cancer. So that's very encouraging news. And we know from the clinical studies that soy doesn't increase or have any kind of harmful effect on the endometrium. So we have clinical data showing that soy is safe, and we have population studies showing that soy actually decreases risk of endometrial cancer. So there's good news on that front.
So now let's talk about lung cancer. Smoking contributes to 80 and 90% of lung cancer deaths in women and men, respectively. Talk about if and how soy reduced the risk of lung cancer in both smokers and never smokers.
Yeah, well, here is where the data get pretty intriguing. There have been a couple statistical analyses of the prospective and case control studies conducted. And what they suggest is that among non-smokers, soy does decrease risk, but it doesn't appear to have nearly as a protective effect in smokers. So there's sort of good and bad news. I mean, it's certainly not going to increase your risk, but it looks like the protective effect is limited primarily to non-smokers. And these studies are coming primarily from Asian countries.
For our final example, let's take a look at melanoma, or the other name for skin cancer. You did state that while only very limited preclinical research involving isoflavones and melanoma have been conducted, there is still a theoretical basis that soy may reduce the risk of skin cancer. Tell us about that.
Yeah, well, that's right. We don't have human studies, either clinical or population studies for this particular cancer. And so I'm very reluctant I would never make any definitive conclusions on the basis of animal studies. But the animal studies actually show that soy prevents the onset of skin cancer. And importantly, it also may, based on the results from the animal studies, inhibit the metastases of skin cancer. So in the model that I'm thinking of, once the animals develop skin cancer, the cancer metastasizes to the lung, and soy was very, very effective at preventing metastases. We also have a little bit of a mechanistic understanding of why soy may be protective, because the skin is filled or very rich in what are called estrogen receptors, but a particular type of receptor called estrogen receptor beta. And that's the type of estrogen receptor that some components in soy called isoflavones are able to bind to. So the animal data is supported by our understanding from a biological basis of why soy may be protective. So I think the strongest data are for endometrial cancer and secondarily lung cancer. But for skin cancer, the data are intriguing. We just need more population studies.
Well, you also emphasized that most of the data presented to understand the impact of soy on cancer risks comes from studies involving Asian populations. Tell us how that impacts the research on non-Asian populations.
Yeah, that's a really important topic. And the reason most of our data come from Asia is because outside of Asia, soy is not consumed in very large quantities. So it's hard to get meaningful data on the health impact of soy from population studies involving Western countries because soy intake is so low. So whenever you're looking at a particular culture or a particular ethnicity, one has to be very careful about extrapolating the findings. So I think that's another reason for being very cautious in making any pronouncements about any kind of protective effects. But one thing is important to emphasize: we're not looking at the rates of breast cancer, for example, in Asia compared to US rates. What we're looking at is the risk of developing cancer among Asian people according to how much soy they're consuming. So as I mentioned at the beginning, men who consume soy in Asia are much less likely to get prostate cancer in comparison to men in Asia who don't consume soy. So I do think those studies are very significant. But again, there's reason to be cautious in general when you're talking about diet and cancer.
Very informative. Dr. Messina, thanks for being with us today.
Thank you very much.
Speaking of soy, a discussion about soy and human health has been brought to you by the Soy Connection Health and Nutrition newsletter and the United Soybean Board. You can find more on this topic in the Volume 25, Number 2 issue of the Soy Connection newsletter. Visit the Newsletters and Tools section at soyconnection.com.